The Water Institute of Southern Africa, or WISA, says COVID-19 has highlighted that the systems in place to make water and sanitation accessible to residents in informal settlements are in contradiction of government policies and are not sustainable. In a press release, WISA stated that there are better and more efficient methods to get water and sanitation safely to informal settlements, especially during this pandemic. To speak more about this, we have the director of the technical committee at WISA, Mike Muller, with us to chat a bit more. Mike, thanks for joining us. Welcome to the program.
Morning to you, Leanne, and your viewers.
So in a nutshell, what would you say is the quickest and easiest way to get water to areas of need given this pandemic?
I think, Leanne, the point that we're making is that we're very concerned that whatever is done isn't just helpful, but that it actually lasts for longer. At the moment, we're sending tankers to fill tanks of water. We're giving people buckets, toilets, which they have to walk out into the crowd round queue to get into. And our concern is that this neither helps us with COVID, because it actually causes people to crowd together and probably spread COVID, but it's also very, very expensive and it's not sustainable. Now, WISA is an organization, unusual organization, because we have members from every level of the water industry, from the people who operate the treatment plants and the wastewater plant, all the way through to people like Neil McLeod, who used to run water sanitation of Durban and wrote this press release. And we just take advantage of the current crisis to draw attention to what we need to do to ensure that that water and sanitation gets to people, whether it's in informal settlements or rural areas. We've got to make sure that it gets there, that it's safe, and that it's sustainable.
So in a press release, WISA stated that the current methods to make water and sanitation accessible to residents in the informal settlements in South Africa are not sustainable. I know you've touched on it a bit more, but let's go into that, because we're in a pandemic. This is desperate. We've been told to wash our hands. We need water for life, and that's just on a normal day. But during a pandemic, it is even more essential now.
So what we're finding is that many of the places where we have these emergency supplies being taken at very high cost, we're talking 20, 30, in some places even 50 times the cost of providing piped water. There are pipes, there are taps, they're not working. And what we are trying to emphasize is that providing what appear to be important emergency supplies is actually distracting us from the long-term problem. It's the same with sanitation. Government is committed not to have bucket toilets in South Africa. But what we see in the informal settlements is even worse. They shared bucket toilets. We call them chemical toilets. These plastic hockeys that people are expected to use, share maybe one toilet for 50 or 100 people. Those are just as bad as bucket toilets. And there are alternative solutions, which in fact my colleague Neil McLeod has demonstrated in Tekwini, alternative solutions that can give a much better service, a more dignified service, and a safer service. And we need to use this epidemic to do things better, because, Leanne, tomorrow it won't be COVID, it will be diarrheas, it will be, if we unfortunate enough to have cholera, it'll be other health problems. Water and sanitation is a health solution for many different purposes, and we need to make sure that it works properly. And we don't do that by dumping plastic tanks or chemical toilets in the veld and saying, oh, well, we've made provision. We've got to organize and do better than that.
Absolutely. I mean, these are not, like you say, this is not sustainable. Now, you mentioned that there are taps, there are pipes. But what condition are they? Can they be repaired? If we had to go that route, would they be able to be repaired and be put into use that can be sustainable for the future?
This is what we are saying we must be doing. We've spent, in the current COVID interventions, at least 600, 700 million rand just to keep tankers driving up and down the road and filling plastic tanks. With that money, we could have been fixing the pipes. We could have been intervening in the municipalities to find out why they have stopped providing water in these areas. We could install what's my WISA colleagues are proposing, container-based sanitation systems which are designed so that they can be kept clean and that they can be emptied on a regular basis. There are solutions, but they require thought and they require organization, and they require that we keep doing the job even after this epidemic is over, which it will be over, but the water and sanitation problems are going to remain.
And this is a problem. This is not new. This has been with us for a very long time. It's just been exacerbated. And what you're explaining to us is, to put in a brief term, we're putting a Band-Aid over a massive problem, whereas instead of fixing the wound, you're actually putting an infected Band-Aid over it to make it even worse. And these things that your colleagues are recommending that can be put in place, the solutions to be put in place, are they achievable? Have they been recommended to government? And why are we not going that route?
Well, I think in the case of the water supply, certainly I know in the rural areas, there is now an acceptance that we can't have trucks driving 50 kilometers up a dirt road to try and deliver water to people. You've got to try and make the solution permanent. And I think in the next round, they will be looking, as they should have done right at the beginning, for water sources close by from, a borehole, a stream from which water can be provided. And that is the way to go forward. What we need to avoid is the situation that's arising now in many, particularly in the rural areas more than in the informal settlements in the urban areas, where when the truck arrives and people have been waiting for 3 days for water, what you have is a huge crowd of people crowding around to get water, crowding around a driver who's come from a town where there's probably COVID. And, as a public health person, and, water is about public health, I look at this and I say, this isn't helping people. This is potentially a machine for transmitting COVID into safe communities. And in fact, if you put in a borehole and you taught someone in the community to look after it, and by the way, you stopped some of the criminal elements who would like to sabotage it because they sell water by the tanker load, and if there's a good supply of water, their business model disappears. If you just get some community organization and community support, you get a long-term sustainable solution for the same amount of money, and you solve the problem. That's the direction we'd like to see government at national and local level going. I think they're hearing, but so much to do and so many challenges. Easier sometimes, as you say, to put on a Band-Aid.
Right. So I want to just look again at this press release or the findings that was put out. WISA basically saying that government policies are being contradicted. I want to focus on this a bit. Which policies are you referring to here?
Okay, first let's be clear about sanitation. We've said that we don't want bucket sanitation. And for some reason, people feel that having a plastic container, which people use as a toilet, which gets emptied, if we're lucky, once every couple of weeks, that this is not a bucket toilet. It's pretty much the same. So this in itself is a contradiction of government's policy to provide a dignified and safe form of sanitation. On the water supply front, government is committed, it's a basic human right, to provide at least 25 litres per person per day. Now, I've looked at the numbers that have been reported from the current water program, the emergency water program. If people are getting 5 or 6 litres of water per day, we're lucky. Now, with 5 or 6 litres of water per day, I can tell you, you are not going to wash your hands with it. You're using it for cooking and cleaning and washing. And you're neither achieving your goal of addressing the COVID prevention, nor are you anywhere close to providing that 25 litres of water. It's a bucket of water per day, which is actually the minimum that people need. And that's what we've got to try and get to. We won't do that through tanker systems. So that's another contradiction of government's policy and its commitments.
Finally, let me just look at this now. In this release that you put out and from everything you've described, and I understand that WISA saying that transportation of water to informal settlements is almost 20 times more expensive than the piped water. And that in itself, we keep on talking about wasteful expenditure. We keep on talking about this COVID money disappearing and all of these other issues that we, are unfortunately burdened by right now. So let us get from you, as we wrap this up, short-term solutions that inevitably will offer a long-term solution, because this truck issue is with us. It's been with us for a while, and it doesn't make sense. Let's talk to a quick short-term solution, and then that long-term solution, obviously, that'll stem from it.
The quick solution is to ask the municipalities where these tanks are providing water to informal settlements. Where is the nearest pipe that carries water to your other consumers? Is there water in it? Can we connect a plastic pipe for the moment to it and take it and provide a stand of 10 or 20 taps in the informal settlement? Why can't we do that? The money we're spending on the tankers could pay for that. If there's already a supply and it's not working, why not? Has it been cut because somebody is trying to sell tanker water and they're making a profit out of it and they don't want to have to compete with piped water? In that case, talk to the police, talk to community safety, organize the community, and the next time that happens, chase that person away. And I have to say, this happens all over the country. This is not a rare occurrence. So municipalities have to be overseen to make sure they're doing their job, and communities need to organize because they know when these things happen, and they need to act in an organized way and raise their voices. And I think, social media and yourselves, the formal media, have a role to play. Shine a spotlight on these cases where there was water supply, it's disappeared. Where's it gone? Who's taken it away? Why isn't it working? Let's spend the money properly, because, Leanne, you're quite right. For the next 5 to 10 years, we're going to have to use our money carefully and sensibly, and we won't be able to just throw it around as we perhaps have done in the past. And this could be a start.
Mike, we thank you for your time. Such a vital issue, it really is. And I hope that this report finds its way into the right hands and action is taken, because it really, really needs to be dealt with very speedily. Mike Muller is the director of the Technical Committee at the Water Institute of Southern Africa, or WISA, talking to us about the accessibility of water and sanitation in informal settlements amid the COVID-19 pandemic. Sakina, when you think of the cost associated with this, 20 times the price is what's being spent on transporting using trucks and tankers, whereas when you just look at the pipes, find the water source, run the pipes, have a tap in a community, you save all that money, and it's a long-term solution. I feel like sometimes we're so short-sighted. We never look to the future.
Indeed, and the question was put there, a challenge, as it were, to communities.
Yeah.
When did you last stop to ask, where is the closest pipe? So communities have to become active citizens as well, in the absence of which things will happen to you, as opposed to you actually electing people that will do the things that you want.
Yeah, crazy. Really, really interesting. That interview shed a lot of light on all of that. But so have these tweets that we've been receiving from our question of the day.